We get a lot of questions from patients about when or should I have my breast implants removed. And these are often patients who have high levels of anxiety around maybe some illness that's being caused by having an implant in place. We kind of sit with these women and say, the first thing we want you to know is that we hear you and we understand what your concern is. And I think the first question that these women need to ask themselves, or that you need to ask yourself, is what is your level of anxiety around your implant? Have you just read some information? Have you heard people talking about it and that's kind of stirred this in your head? Or is there a really deep-seated anxiety around the presence of an implant? The second part of should I have my implant removed is, are you just absolutely done with implants? But you have to decide, are you open to an implant at all? Because there can be other options of switching from one type of an implant to another, from one size of an implant to another, that can accomplish the same goals without completely removing the implant. And then the final question that really is important is, do I care how I look? The reality is that when you take an implant out, it's going to have an impact on the appearance of the breast. And so we find that this is a really important time for patients to just sit and have a candid discussion with a doctor. If you find yourself in that place, we'd welcome you to come in and call for a consult and sit down, where we can kind of walk you through that process where you're at with your breast implant and your journey right now, to come to a really informed and educated decision that's best for you.